Welcome back. This is My Morning Surgery. Dr. Jonty and I have now been joined by Jonquille, our resident cosmetic surgeon. Good morning.
Morning.
Her patient Lisa is also here, and this lady will be having her very first dermaroller treatment just over there on that bed in a few minutes. Firstly, Jonquille, layman's terms, for myself and the audience here and at home, what is dermaroller? What will it achieve today on stage?
It's a revolutionary new device which allows us as surgeons and doctors to treat various types of scarring, traumatic, burns, acne scarring, in a way that we've not been able to before. Previously, we had to use quite aggressive lasers or go in and actually do surgery to revise the scars. But this will allow Lisa to come into the clinic, be fully awake, have anaesthetic cream on for about half an hour, and then we can do the procedure, and she walks away, goes back to work.
And again, very basic, it's a roller with lots of little needles in it.
It is. It's based on a technique called skin microneedling, and it causes very small little injuries into the skin. The damaged skin then gets repaired and regenerated by the surrounding skin, which allows then the skin to fully regenerate. Fantastic.
Lisa, for you, welcome to the show.
Thank you.
You've got a story, and it's important that you tell it. How did you get them, I think, would be an important starting point.
Well, this scar here I went through a window when I was just a toddler. I was playing near to French windows, and my head went through the glass. I'm lucky to be alive, I really am. And so it was always a vanity issue, having something actually done for the appearance, you know, to make the appearance look better. In my 20s, I just felt that I would go and seek advice from the doctor, and I had my scar revised, and I had smaller scars revised here as well. But the appearance was worse. So from then on, I just used concealers and bought treatments and everything, and I wasn't aware of any other treatments on the market or anything. And just, you know, more recently, I've found out about this.
Jonty, if I can bring you in here.
Sure.
What's your view of this procedure? I'm very strong on this, actually, but you go first.
Okay, yeah, no, well, I mean, I don't know much about it, is the honest answer. I mean, at the end of the day, you know, it's not something, unfortunately, that's available very much on the NHS. So as an NHS GP, you know, I don't know much about these procedures. I'm really excited to see how it works. And I think it's something that it certainly wasn't anything I was trained in at medical school. I mean, things have you know, transformed completely. Previously, you would have had to have a significant operation to try and revise a scar. And now we're talking about something that can be done, you know, here today in the studio. So things have changed tremendously, and I think for all of my patients, you know, like Lisa, this would be life-transforming, genuinely, really transforming.
Isn't that the point, though? The nice thing as well is that as developments happen, and we're hearing about them on this show with you, Jonquille, you know, anybody given the opportunity to do something that's safe, that's not complicated, that improves how you see yourself, how you live your life, how you feel, is the most important thing.
In terms of today, the risks are very, very few for Lisa. We've already been through that.
Is it painful?
It's a little bit uncomfortable. That's how patients describe it, as uncomfortable. In terms of risks, she'll look pink for the next couple of hours. There's a risk of bruising, some swelling. And there's a risk of also it not quite meeting her expectations.
And how many times would she have to, Jonquille, see you?
We will need to do treatments, possibly 3 or 4 sessions, 6 weeks apart. So Lisa may see a little bit of a difference in her skin in the next few weeks.
Come on, guys, let's go. Let's continue the conversation. You all right there?
Yeah,
I'm really interested to see this, I have to say. I'm sure the audience... We're going to play it on the screen, the big screen, guys, so you can see.
This way.
Yeah.
Are you all right getting on there?
Yeah.
Girl.
Thank God it's not too high.
You're all right.
Okay. So I'll next see Lisa in 6 weeks' time.
Okay.
And that's because it will take the cells that we are stimulating to produce Lisa's collagen about 6 weeks to start to work. But some patients do start to notice the difference before then. So we won't see anything visual today.
No, I'm not actually. No.
We'll just see a little bit of thickness.
She knows what she's doing.
Anaesthetised the face. You said that before. There was some anaesthetic gel, yeah?
Yes. Very gently.
You feel anything? Seriously? Is that quite numb?
It's numb and tingling.
Okay.
Yeah.
Can I just say, actually, for the people in the audience, or maybe those at home, there might be a little bit of blood, apparently. And if you're squeamish, as I am, it could be quite interesting. Bear that in mind. If you hear this bang, it's me on the floor, all right?
Okay. So what I'm going to do is actually start with the normal areas of skin. Lisa has a very small scar through here. again through there, and then obviously the bigger scar down here. I'm also going to treat the rest of the skin so that she gets a general skin rejuvenation. Okay?
Can I just have a look at that? Can we
sure.
just put that on camera a second? Because you can see. You can see all the little
This is an
needles
average length of needle that we would use for
and
this
that rolls
procedure.
across the skin?
Yes. And I really would advise patients to not buy them off the internet and go start rollering their own skin, because they can actually scar themselves permanently.
Now, does that hurt?
No, no, that doesn't hurt. No, not at all.
Okay. So
It's obviously a strange sensation, but
yeah.
Are they quite strong, hard needles?
Yes.
Are they plastic? They are.
No. Yes. They're strong needles, which are not at risk of fracturing. We can also use much longer needles for patients who have really severe stretch marks following pregnancy or severe weight loss, and that can be something that really affects women and men.
Can I ask a really stupid question from a man?
Yeah.
That's bleeding. That's going to sting after the anaesthetic wears off, and then the skin would contract almost. Is that part of the knitting process? Is that the reason?
Partly. Lisa won't feel any real discomfort
Scabs?
after this procedure.
Any
No
scabs?
scabs at all. Nothing. This is only very minor into the skin. You will see this pinpoint bleeding that we can see, but it won't be anything where she has scabs or any grazes, anything like that. If that were to happen, if it's been done badly, then that could potentially scar her.
Now, I'm going to move off, not because I'm about to faint because of the blood, but we're going to leave you to that procedure. Are you all right, Lisa? Then?
I'm fine, yeah.
Fascinating. It is fascinating. Can you see that on the screen, guys? All right, we're going to leave you, Jonquille. Thank you very much indeed, Lisa. I just want to, if I can, change screens. Jonquille, I just wanted to... goodness me, I just wanted to sort of update, really. Lisa, how are you doing?
Okay.
I don't know if you can see that. Can we get that on the screen? That's extraordinary.
So what you can see is that it's nice and pink.
Yeah.
A little bit of blood. And the reason why blood's great is because it has lots of healing factors for the skin in there. So the natural process of having blood on the skin will help to contribute to the healing process.
How does that feel, Lisa, just lying there with this roller being rubbed across your face?
The feeling itself is a really strange sensation. I have to admit, it doesn't feel comfortable, but it doesn't feel unbearable. You know, I'm lying here, I've not flinched or anything.
Now, just out of interest, how much more have you got in terms of work to do on Lisa?
Very little.
Really? Okay.
In this sitting, nothing.
So you're going to wipe that off now?
We'll wipe that off.
Can everybody see that? Let's just...
Jeremy, can I ask a question very quickly?
Yeah, sure.
Because obviously I've got a lot of patients who I know would be interested in these sort of procedures, and I, even as a GP, find it very difficult to advise them where they should go.
Yeah.
Because I know, obviously, don't get something from the internet, but how do you know that someone's qualified to do this?
You should always check their registration. So for doctors, it's obviously the General Medical Council, and they should have received official training status for any procedure such as this.
Okay.
Yeah.
So you're now removing the excess blood from the skin?
Yep. It's dried on a little bit, but...
you see, that's amazing, because now, tomorrow, for the next couple of days, quite red, the skin?
No, she'll look normal by tomorrow morning. Lisa will be able to go back to work tomorrow, nobody will notice anything.
So, Jonquille, thank you so much. Yet another amazing procedure. Lisa, it's going to be fascinating, I guess, for you to see how this pans out. It's been really interesting to see it. You're going to see this through, yeah?
Yeah, definitely.
All right, listen, thank you for coming on the show. We wish you the best of luck, Jonquille. Thank you very much. Give him a round of applause, everyone. Thank you, guys.